I'm Erin Kiernan. Thanks for being with us tonight. Fentanyl is commonly given to women who are giving birth or people who are battling life-threatening pain. Staggering numbers now show it is taking more lives right here in Polk County than any other drug, and it is showing no signs of stopping. WHO 13's Justin Surrency explains why local groups and grieving parents say Iowa is losing the fight against fentanyl.
Next to the cardiac arrest, son's not breathing, and they have already administered Narcan. They are currently doing CPR.
Deadly.
Unless you are there when it happens, there is no saving them.
Deceiving.
So this is, a 16-year-old kid taking one pill that should just be a hydrocodone 500 milligram, right? And should be going about their day. They're dying.
Destructive.
Unfortunately, 2 out of 5 of these fake prescription pills contain a lethal dose of fentanyl.
Fentanyl is tearing through Iowa communities and across the country, leaving families with grief.
So it's really sad to me. I couldn't even tell you how many funerals I've been to at this point. I haven't gone longer than, I don't think 20, it's like 24 days in the past 3 years that I've not heard of someone that I personally had a relationship with that has passed.
In July of 2021, fentanyl helped claim the life of Kathy and Derek Kidd's son, Sebastian.
I didn't know what fentanyl was until this happened.
Sebastian was just a 17-year-old, soon-to-be senior at Carlisle High School.
Sebastian Alexander. Yes. Known for his eyes and his smile.
Preparing for his soccer season and having suffered from several concussions, a broken collarbone in the past, depression, and headaches, Sebastian was self-medicating with Percocet to help sleep.
He took half a pill. We found the other half.
Derek says his son was receiving the pills from a user on Snapchat, and on July 30th, he never woke up in their Des Moines home.
I opened that door and I saw him laying over his bed with his clothes on, and I I knew. I said, "Get up, bud, it's got to go to work," and nothing from him, and I touched him and I knew. Started screaming, and my wife called 911. And
2 months later, a medical examiner confirmed to the family the cause. The Percocet was laced with fentanyl.
You don't know that it's in there. You don't want it. You have no idea.
For Gabby Ruggiero, a state opioid response grant coordinator for Employee and Family Resources, this heartbreak is unfortunately increasing rapidly in Iowa.
For the first time, fentanyl and opioids were causing more deaths than meth.
That was the first year ever?
Yeah, first year for Polk County.
The Iowa Department of Public Health estimates fentanyl-related deaths rose from 31% of all overdoses in 2016 to 87% in 2021.
Especially with fake prescription drugs, we're seeing that young folks are buying these pills that they think are something like Xanax or Adderall or Percocet, but really it's fentanyl that's been pressed into pill forms.
The CDC says fentanyl is 50 times stronger than heroin and up to 100 times stronger than morphine, but much cheaper, easier to manufacture, making it easier to purchase on a budget. Ruggiero believes many are unaware that their illicit drug or pill has been crossed with fentanyl until they become dependent on it or dead.
If someone develops a dependence on this drug, over time their brain will literally start to change, and the brain will compel that person to use even when they know there are negative consequences.
Deborah Kraus was once dependent on opioids.
I can tell you from experience, to detox off of an opiate is one of the worst things I've ever been through in my entire life.
She now serves as director of the Central Iowa branch of the Iowa Harm Reduction Coalition program.
It's giving people safe using supplies.
Her nonprofit works tirelessly to educate drug users and communities through education and advocacy, but fentanyl is outpacing everyone.
It's scary in a way that there's no regulation to stop it.
Kraus says there is an important medical purpose for fentanyl, but the doctors prescribing it have the right tools.
It blocks the pain receptors in your brain, right? So fentanyl in and of itself is not inherently bad. It does the job it's supposed to do.
Those dealing the opioids or other drugs aren't measuring the amounts of fentanyl in a product like a medical professional would.
In an unregulated market, all you're going to see is people dying from buying something that they thought was something else. And a lot of times they're not seeking fentanyl.
To help reduce harm for those seeking opioids or other drugs, but not the fentanyl, the Iowa Harm Coalition distributes fentanyl test strips that can check whether or not substances are positive for fentanyl.
1 line is positive and then 2 lines is actually negative.
While federally legal, the testing strips aren't just controversial. As of May 4th, they were illegal in Iowa, in all states except for Arizona, Delaware, Wisconsin, North Carolina, Tennessee, New Mexico, and Alabama because of paraphernalia laws.
I don't see it as enabling. I see it as trying to keep people healthy and keep people safe and keep people alive.
Fentanyl is small but sinister. Medical experts say 6.5 grams of cocaine, the same size of 2.5 teaspoons of flour, can be deadly. When it comes to morphine, just 200 milligrams, roughly the same size as a simple pill of Advil. When it comes to fentanyl, just 2 milligrams, the same size as 2 small grains of sugar, can be fatal.
Like when you go to a restaurant, the little sugar packets, you can open one of those up, shake it all till you tap it till you think you have everything out. Just the little residue that's left, if that was fentanyl and you put it in your mouth, it could kill you.
Ruggiero and Krause agree that perhaps the silver bullet for the fentanyl epidemic is naloxone and the well-known manufacturing brand Narcan.
Narcan is the opioid overdose reversal drug, and anyone in Iowa can get this for free.
Experts say naloxone belongs in the home and in the community. Everyone should carry it, not just those with prescription opioids in the home.
Also for businesses, anywhere where people are interfacing with the public, this overdose crisis is not going to go away anytime soon, and we have this great free tool available to us.
Families Against Fentanyl, a national organization, says fentanyl-related deaths are now the leading cause of death among Americans ages 18 to 43. It is claiming 64,000 American lives a year, or 175 per day. The DEA says in 2021 there were more fentanyl-related deaths than gun and auto-related deaths combined. The kids are in the process of partnering with local school districts to share Sebastian's story and refuse to quietly ignore what took their teenage son.
Because the easiest thing in the world would be just to close our doors and, and not talk about it. Mm-hmm. But that's not going to save any lives, and that does not do...
That doesn't honor him. That's not what he would have wanted. That wasn't him.
Iowa's fight against fentanyl is more than an uphill climb, but there are organizations refusing to give up.
When we start to think about this as a medical issue, it really destigmatizes it and makes us think, okay, we need to treat this like other chronic diseases like diabetes or hypertension, where someone has continued care throughout their life.
Lives saved because of the power behind voices that can no longer speak and their loved ones crying out with warning.
And I know it's hard to sit down and have those very raw, uncomfortable conversations with your kids, whether it's, friends, sex, drugs, whatever it is. But you have to sometimes, and it's okay to be uncomfortable. It's okay if somebody gets mad and doesn't talk that night, because they're uncomfortable. Hopefully everybody's around the next day and you continue the conversation and everybody learns and you live.
In Des Moines, Justin Cernsey, WHO 13 News.
The United States Drug Enforcement Administration says Mexican cartels source raw, dangerous chemicals from China, then use those chemicals to cheaply produce the deadly fentanyl. The DEA says once fentanyl is trafficked into the U.S., it's then mixed, like Justin mentioned, into almost every illicit drug. It's then sold to unsuspecting buyers. If you'd like more information or to find resources and organizations currently working to fight this issue, go to our website, WHO13.com.